Hi everyone, welcome back to our channel. Today I'm going to talk to you about smokers lines treatments and what we do at our clinic, and also, as always, give you a general overview of what smokers lines are and why these treatments work particularly well for them and when that might not be a good course of action. So before we begin, if you're here again and you're enjoying our contents, please be sure to subscribe and hit the notification button. If you have any questions, leave any kind of aesthetic questions in the comments below and I'll answer all of them. And as always, I'll put some relevant links to some relevant content in terms of the treatments and the problem itself in terms of smokers lines, so that if you want to read a little bit more, you can. So smokers lines are basically the vertical lines that people get around the lips. The most common are around the top lip, but you will often see in more severe cases that you also see lines around here. And they happen in men and women, and actually the term smokers lines is a little bit misleading. Anyone can get these lines, so really they're caused, as with all wrinkles and the rest of our face, by aging and by muscle activity. So in the case of smokers lines, it's kind of this action here that over time and with skin aging and with a decline in collagen and elastin, you get these vertical lines in the direction of that movement. Yes, they are, smoking does exacerbate them and it does make the lines worse, but plenty of people who've never smoked in their life also have these lines. So it's just important, and we often kind of refer to them as vertical lip lines, just so that we can clarify that this isn't just the only reason that, or the most common or only reason you get them. With these lines, some people, quite a few people are bothered by them, and that's why we tend to get referrals in our clinic, people coming to see what treatments would work best for them. When they come in with them, they complain that actually it's kind of just causing unnecessary attention to their mouth, because that's a very prominent, your lips are a very prominent part of your face. If they wear makeup, then makeup is kind of caking in there and making it look worse. And also, if you're wearing lipstick or lip liner, you lose definition of the lip and you find this feathering or bleeding of the lipstick in that area. So these are kind of the common reasons, and this is why we've adapted our treatment specifically to answer all of these responses. And of course, people who don't wear makeup also have them, and we see these in men and women equally. So with that being said, our treatment is severalfold. So one of them is to relax the muscles in this area, especially the top muscles. So we use Botox anti-wrinkle injections for that, and these muscles relax the muscles at the top, which kind of exacerbate this movement happening. So the Botox will do that, and it will stop the muscle from making the wrinkles bigger or worse. And then we combine that with a dermal filler, and we use Teosyal RHA2. It's a hyaluronic acid dermal filler that's been specifically designed for use in really mobile areas. It's a really soft filler. It's not there to augment or to plump up, it's just there to provide support without having any visible fullness in that area, which you don't want. You don't want that kind of bulky effect. And it works like silk. The treatment, you see results straight away, but then as the Botox kicks in about 2 to 3 weeks, you start to see the combined effect, and the filler settles by then. With the filler, we also deposit in a few different ways. So we have lines that go this way of filler that act as a support, as a foundation, and they lift up the wrinkle. And then we also go around the lip line itself, which again restores that boundary, that really important boundary between the lip and the rest of the skin around the mouth. So you get a younger looking, a fresher looking lip, because you've restored that border and you've strengthened it. And then you also get smoothing of the wrinkles around here. And then with the Botox, you stop them from getting worse. With the treatment itself, the fillers themselves last about 6 to 8 months, in some people a little bit more than that, but that's the average. And then the Botox lasts about 3 to 4 months. So moving forwards, to be honest, the majority of our clients just tend to repeat the combined treatment when the dermal fillers wear out. So the effect tends to last longer for some reason around here, the Botox, than it does sort of for the frown lines or the forehead. But in people where it might last just as long as it's expected, about 3 to 4 months, they may top up the Botox before the next bit of filler is due. Again, each person has their own needs, their own expectations, and that's the beauty of these treatments. If you take a personalized approach, you always end up with the right treatment for the right patient. So really that's kind of the main way we treat these lines. There are other ways, so people, for example, use laser therapy to resurface these lines sometimes, and that works by kind of exfoliating the skin, so it helps smooth the skin around there, but it doesn't really provide any lifting of the skin. For very fine or early lines, microneedling can work quite nicely because it stimulates collagen around this area. And of course with microneedling you perform it on the rest of the face as well. Profilo might work quite nicely again in kind of earlier cases of this because it refreshes the skin and it stimulates collagen so that you don't proceed to these kind of marked wrinkles. And then of course in really severe cases where there's a kind of really extreme lines, you may end up requiring something like a surgical intervention. But for our cases and the people that we've treated and seen in a range of age groups, this seems to be quite a nice procedure for moderate or moderate to severe vertical lip lines or smoker's lines. So anyway, that's sort of the end of it, and please leave a comment below if there's anything that you want to ask about these treatments or vertical lip lines, smoker's lines themselves. And don't forget to subscribe and ring the notification bell, and until next time, see you.